Good evening, everyone. I'm Professor Ying Chong, Medical Director of Complete Fertility. And I'm just welcoming all of you coming in now to our webinar. I'm just going to wait for a minute or two for everybody to come in, and then we will start very shortly. So thank you all for spending some time this evening with me, and we'll talk you through in this information evening what to expect if you're having treatment as a single woman. So as I say, welcome those of you who have just logged on. I'm Professor Ying Chong, and I'm the Medical Director for Complete Fertility. And we do these webinars to share the information that women find useful to start their fertility journey. So I think the time is now 1 minute past 6:30. So I think we'll start. So welcome everybody. As I said, for those of you who've logged on earlier, I'm Professor Ying Chong, Medical Director for Complete Fertility. I'm also, of course, the Professor of Reproductive Medicine in the University of Southampton. This evening, I'm going to focus on information for you as a single woman going for treatment. So what are we going to talk about? Well, the first steps, right, always the most important one. But I also want to introduce a little bit about ourselves in Complete Fertility. I'm talking to you now, but behind me, we have a huge team of nurses, doctors, admin, support, donor team, all making this, work for all our patients. Then what would we need to do to help you create a family? I'll also touch on, of course, what the fertility treatments we have are. We'll help you, of course, navigate sometimes some quite confusing next steps, hopefully simplify it in this presentation. But of course, in COVID times, we always want to update you on what the latest guidance is, because of course it is a worry and has been so for the past 2 years. Surprisingly, 2 years have passed, and we've lived in this pandemic now almost 2 years. And of course, ask questions in the chat function, and I'll be able to of course, answer some of the questions as the best as I can, right? So it's time, right? You'll be thinking, right, what's next if we really want to make this, if I want to make this, successful, what do I need to think about? Donor insemination, is it to inseminate? Is it to freeze my eggs? Is it, that we have to attend to some potentially related female or unexplained subfertility, and perhaps some more complex investigations and treatment? Where do we start? It is not surprising that, the recent years, we have seen a huge increase in demand of women wanting fertility treatment as a single person. Of course, with their family support, with their friends support, siblings, everything, but a huge increase, as you can see there in the figures. Now, who are we? Who is in Complete Fertility Center Southampton? Well, just to give you an introduction, we are a member of the Virtus Health, the leading fertility provider actually in Australia and Ireland, with a growing presence, of course, in the UK, Denmark, Singapore. What is important is we are international, all right? So we have the expertise in the international scene to help you achieve your ideal, your pregnancy. But we, of course, want to help you optimize the chance of achieving a healthy singleton pregnancy, right? One at a time. Healthy baby is a very important outcome we would like to achieve for all our patients. How do we do this? Well, we are, of course, in the know around evidence-based, high quality care, individualizing your care. As you know, we're attached, within a leading UK teaching hospital, but also we are very active in research. And so you are at the cutting edge, wherever, in terms of the treatment options, right? And we have, of course, clinics in Portsmouth, Bournemouth, Chichester, and Southampton. Now, this is a picture I always try to get through really quickly because very embarrassing, all the pictures. But here are, the founders, Julia here, and that's myself. And then, of course, we have our very expert team of consultants there, right? So what does your journey look like? Well, your journey will look like this. You can refer, get patients, GP referral, NHS private consultant assessment. We will assess you, the doctors will assess you, investigations, and then some of you may need some surgery, medical optimization before fertility treatment, and some of you will proceed straight to treatment. But it all depends on your individual circumstances. So it is very important that we know, more about your history. We're very detailed about your history, get you to fill up quite a bit of forms so to understand and talk to you about your history before we proceed on. Okay. Treatment options, what are they? Well, first of all, you can be looking at donor insemination, so inseminating with intrauterine insemination. Don't worry, I will explain this later in terms of the details. These are some terminologies I'd like to introduce to you. You have your in vitro fertilization, ICSI, sperm injection, intracytoplasmic sperm injection. And not every patient will need, or every woman will need this type of treatment. I'm just saying these are some of the options, right? And sometimes some patients will, some women will choose to freeze their eggs, and then sometimes they may be returning because they have some embryos frozen. So these are the different treatment options that is possible, right? And how can we help? Well, as you can see, we have a very high quality, regularly screened donor sperm program, all right? And we reserve it for our patients. And of course, we provide you with individual care. The price packages, I hope, are competitive because we package the price so that it's understandable for our patients and are competitive and not too extortionate. We have also very good success rate because we are, of course, leading in technology and the best care. And we, of course, also offer a fertility assessment, MOT. I don't quite like the term MOT, but patients like that. But it's about assessing where you are with your fertility. Some of the tests, do some scans, just check, because it's important to a lot of women. They want to know where their fertility is. Who are our donor team? Well, our donor team actually is grown. So these are 2 members of our donor team, but here they are, very, very happy, smiley faces. What do they do? They're absolutely key in coordinating egg, embryo, and sperm donation program, right? Dedicated phone lines and provide information for our sperm donors wherever available. Who donates sperm? You might already know someone, or we have our own sperm bank, as I said. right? The reasons for donating often because they know someone that struggled to conceive. So it's very altruistic, people who donate sperm. We have a reasonable number of sperm donors in our bank, and they vary in what they do, how they look, what they write. But of course, there is a 10-family rule in the UK about sperm. It's regulated so that a sperm donor can't donate forever and ever, right? And the UK regulation and the law is that 18-year-old child may contact the donor. But of course, this doesn't have any legal implication about who their legal parents are, because that's obviously the legal side of things. So there's no implications on that. But a lot of the research has shown really children really just want to say thank you, and they just want to know. So the law in the UK, they're allowed to know if they wanted to. Okay. And this is how does it happen? Well, this is a nice example of the website we will provide you, and you can see, I think origin, eye color, hair color, height, occupation, the type of treatment, and the number of allocations here. So it's really quite simple. You can take your preference and see what we have there. How do you select? Well, it's very individual, to be honest. I have that patient that says, look, I don't really mind. I have had ethnic patients that says, actually, I don't really mind. And I have some patients that says, I really need this, that, Of course, the stricter your selection is, the more difficult it is to fit everything. The wider your choices are, then of course, the more you have choice to pick. So, but, you can see here what is available to see. Right. Of course, you don't see the face, but this is just a picture. So the available donors. But I always say, look, at the end of the day, you can pick blonde hair, blue eyes, or whatever. But to be honest, the genetics doesn't always follow, as you and I know, right? So therefore it doesn't always follow. So just be aware that characteristics don't always follow through. This is a slide about egg sharing. What is egg sharing? Well, you share your eggs, you donate half the eggs at the collection of IVF to an anonymous donor. That does give you some advantage of having a significant discount in your own treatment. But to be honest, my clinical experience is a lot of patients share eggs. If they did have to go through IVF, they share eggs because they don't, it's not about the payment or whatever. It's about the wish that they can give patients a gift, other people a gift. It's very altruistic. So, but this is just so if you're going to go for a treatment like that, for example, there is an option there that if you're suitable, we're calling for people to consider donating half eggs if they're actually in that way inclined. Of course, it's not something that you have to do, right? Egg freezing, yes. I mean, that this is getting more and more common because, of course, people are getting more busy. They want to establish a career. There are all sorts of reasons why people want to be freezing their eggs now rather than later. Now, I would say, as a medical person, if I want to freeze my eggs, I will freeze it when you're much younger and not when you're in your 40s, because as egg quality is much better at a younger age. And so a lot of women are actually considering that, because they haven't made up their mind what they're going to do in terms of their partners, etc., etc. Yeah. So that is an option there. This is a picture or cartoon of how, just to describe to you what the process of intrauterine insemination is. Okay, as I said earlier, that's one option whereby a woman will undergo some stimulation. We scan your ovaries to make sure you're growing eggs. And then, of course, we make the eggs ovulate. That's called trigger. And then once the eggs ovulate, we can then pop the sperm in, the donor sperm. And then you take some hormone support and you do a pregnancy test, which we hope is pregnant, as positive, and then you get your pregnancy scan. So the whole thing is 2 weeks time, really quite short if you think about it. So this is what we call intrauterine insemination, or DI, donor insemination, or intrauterine insemination. This is an example or cartoon of a flow of what IVF process is. And it starts with an injection, about 2 weeks of monitoring, and then we pick the eggs out of your body. So it is more invasive, right? That's why IVF cycles are always more expensive than intrauterine insemination, because it picks out the eggs, it forms these embryos. Can you see this time lapse, which is showing you a video of how the embryos start to form? Can you imagine? Few cells and now few hundred cells, blastocysts, right? This video is amazing. Always get intrigued by how the humans actually start off, how fertilization and how it grows. But when you get this mature embryos, we would pop them in very gently into the uterine cavity, and then any spare embryos get frozen, and of course, you do your pregnancy test as usual, and hopefully it is pregnant. The success rate of IVF is always a lot more than IUI. However, in a person who has never had fertility problems before, IVF maybe can achieve a 40% success. The insemination per cycle, each treatment cycle, and then the IUI, which I showed you earlier, maybe 15-20% in our hands. All right, sometimes higher. It's very individual. All right, but this just gives you a flavor of what actually happens in a fertility journey. And these are some photographs of how beautiful people that works in our center, totally dedicated to our center. Very, very pleasant, really loads of nice comments from our patients from before about, the service and things that they provide. But, how can you not say that smile is really smiley on these pictures? And this is our embryology team. Look at that. That's a pretty picture of our embryology team. I love them to bits. They have their incubators here, which they actually call by name. Each incubator of our lab has a name attached to it. That's the sentiment we have to our embryos. They are, again, looking after your embryos. What happens in the IVF lab, that's where all the magic happens. I can tell you that, embryologists look after the eggs, sperm, the embryos, very, very carefully, really, really dedicated, 12, 16 hours every day, 24 hours around the clock, and you can see some nice, pretty pictures here. This is an egg, believe it or not, it's very, very small when it's collected. This is a sperm video. You can see these are the sperm moving around. Look at them, right? And this is a picture, electron microscopy of a sperm and egg, pictorially how it interacts, and of course one sperm will get into the egg. And this is a picture of an ICSI procedure, which is where we put a tiny little sperm, you can see here, into a very, very small needle, and then we inject it. And this is the video there. Look at that, right? This is a video of a sperm coming in there, as you can see, in the needle, right? And with a very, very, very firm hand, embryologist injects it straight into the egg, right? And pop the little fellow in there. Really, really a very gentle process, tiny little puncture. And then you can see that the whole process is now nearly complete. There you go. There you go. Off you go, little fellow, and there you go. That's where the start of the fertilization process happens, right? Amazing. This technology is absolutely amazing, right? I just need to move to the next slide. There we go. Embryo development, you can see here, fertilized egg, cleavage eggs, blastocysts, and then we hatch off. All of us hatched into off our shell, if you know that information at all, at some point, right? We hatch out of our shell into the environment where we implant. And of course, we have our time-lapse incubator now, which is absolutely amazing. And we have also a witnessing system where we check everything about 10 times to make sure that, you know, that's your sperm, that's your egg. It just shows the governance of this process is very, very tight. And of course, at some point, the little embryos needs to go back, and that's where we pop it back into the uterus. And that's the little, there's a picture of how we put back the embryo. And that's if it's in IVF, right? And that's a little ultrasound scan of that. And if you have any embryos left for future transfer, of course, we will be able to take them out from a very, very cold liquid nitrogen tank and put them back. No, I can't recommend Dee enough for all of you. Dee is our counselor, and many of you might feel, oh, you know, I probably don't need that, you know. But to be honest, to have someone who, you know, who knows a lot about fertility treatment and the stress and anxiety talk to you is really important. But of course, if you're going through donating gametes and using donor gametes, it is actually important that you have an implication counseling, because this is HFEA requirement. So that you understand what's the implication of donor gametes use. We also have a very interesting app, which, you know, you can see here. It's called MediEmo. It might not forever be called MediEmo, but we've been developing this for, you know, at least 5-6 years. Many patients have used them and found them very useful. Why do we want to do this? Because we want to make sure our patients get their mood managed so that they're not overly anxious, and they are able to manage their mood in a self-management way, in evidence-based, with an evidence-based support. So this tool was developed and is still being developed in an evidence-based manner. Psychologists has been involved in this, nursing, clinical, everybody, right? So we've developed this. It's really simple, and you look at it, it's not anything really special, doesn't look very pretty, but actually the basis of it is a psychological input. And so we want to understand the psychological support patients. So we introduced this. So this is for you to download in App Store free, all right? And of course, a support group, as usual. As you can see the support website there. Of course, very, very important for all of us. And of course, a buddy system. Nurses will tell you all about this. But it's very important that we all get supported as we go through our fertility journey. I can't overemphasize about nutrition. So we do have someone that we would refer our patients to if they require anything to explain about nutrition, which is a very common question that I get from all of you. Then, of course, here you have the refund program, or the multi-cycle program. As you can see here, you know, that different types of access to the programs. Some of it, well, the refund program, we actually need to provide information so that the access fertility, which is not part of complete fertility, by the way, okay? But they will review it and say, okay, you qualify, and they will provide you with a refund policy. And the multi-cycle program doesn't need medical review, and it just has a a price tag on it and how many cycles is funds. If you want to know more, clearly our finance team can provide you with more information, because I understand, of course, sometimes these things can be quite complicated, but just so you know, there is a funding program we put in place to help some patients who really struggle, if not for fertility treatment, if they don't have some help. Okay. This is just to let you know our HFEA data on your donor insemination results is very good, as you can see there. So just so you know, it's there if you want to, and it's on the HFEA website. And these are just some statements, what HFEA says about our center. It's based in Princess Anne Hospital, busy, clean, well organized, and our staff, as I already said, are very professional and supportive. We try to help all our patients achieve their goals of having their family. And just some, highlights about COVID. Of course, we take COVID very, very seriously. We're one of the first centers that reopen once we're allowed to, because we've put all the processes in place to allow us to do so. But the current question, of course, is around vaccination. And, of course, yes, you should be having a vaccination, and there shouldn't be delaying your fertility treatment if you had some. And of course, there will be continuous different types of COVID questions that comes through to us, and we constantly would be able to answer it for you if you leave some questions for us, or else you can find the government website to do that. But the bottom line is we are equipped to treat in the COVID pandemic. That's the point I wanted to make. So you are safe, right? Why complete? So this is the sort of the reasons for you to come to us. So say I feel our center, our staff are really passionate about supporting you. We really want to get you through your treatment. That's why we spread locally, so that we allow our patients not needing to travel so much or park in a very small car park, with the hospital patients and so on. We have a very good donor program. There's no doubt about it. Right? I talked to you about the the egg share program that you can get if you wanted to go altruistically to help patients, but also have treatment yourself. The packaging, the price packages are simple to understand. There's no catch in there. There's interest-free payment plans. There's some finance payment plan we talked about. We are, quite well known for treating single women. We have very good success rate. And there are some pictures that of our center, because obviously we used to do this as an open evening, but of course we're now doing it online. And so these are just some pictures of the clinic, some of our embryology pictures in the laboratory. This is our consultation room. You can see very bright, very airy. This is our recovery room, again, very bright, very airy. And our treatment room also, there you go, for egg collections and transfer, all the modern machines in there that is necessary. And then I was told there is also £100 off donor sperm if you wish, is an offer to people who are coming to the webinar. So thank you for actually listening to me late into the evening. And I leave you with some of the comments that you have here. You can read it yourself. I'm not going to read it out for you. And I do hope you find this presentation helpful and useful. And just to let you know, I'll be talking at the Fertility Forum on Wednesday. This is a fertility show, but an extension of it. I'll be talking in the expert forum at 9:05 on Wednesday on how the impact of COVID has on fertility, together with other international experts in the field. But I also will be but I mean, obviously you can then, of course, also be listening to the show for other reasons. But just so you know, I will be there representing Complete Fertility and talking as an expert in that area. So I think I've come to the very end of our presentation, and I would love if you want to type in some questions into the chat. Please do that, or into the Q&A, whichever one you feel you're comfortable with, and I can of course answer the questions for you. So very often I get asked, Professor, what should I be doing to optimize my health? And I would say, look, everything that pretty much. So diet, healthy diet, balanced diet. There is not a magic diet, but of course, your greens, your portion size. Look at your BMI, your body mass index. Are you overweight? Are you underweight? Are you normal weight? You're normal weight, and you're healthy. Feel well and healthy. You're probably doing the right thing with your diet, to be honest, right? And of course, nutritionally, we can refer you to our doctor that I talked to you about with nutrition to be really more detailed. But I think generally speaking, if you are, really healthy and in the normal weight category, then that's fine. Supplements. What supplements? Well, the most important thing is actually folic acid and vitamin D, because folic acid will stop, or reduce the neural tube defect incidence. Neural tube defect is is a condition that affects the spine of the baby. It's very important that that folic acid supplement is taken. Vitamin D, of course, because look out of my window now, it's dark. I mean, just a few months ago, it was still bright. I mean, in another country nearer the, separate in the Mediterranean, it will still be bright, but we are now in the darkness. So you got to make sure you have enough vitamin D, because vitamin D is very important for bone, for a lot of function, for fertility even. So make sure you have a vitamin D supplement. Now, the rest of the diet is a question of preference. Now, I certainly like in terms of the type of diet advice, I like to say Mediterranean. Okay, Mediterranean is important because then you're talking about oily fish twice a week, salmon and so on, and that's a sort of nice thing to do if you like fish, right? Otherwise, you can have omega-3 supplement, take capsules. Now, what is the timeline in terms of getting a first appointment to completion? Well, if you see a doctor now, how soon can you have treatment? Right? That's a question I get every day, and but to be honest, it really depends on a lot of things. Now, if everything was spot on, that means there's no additional tests we need to do, health-wise, no issue, everything. It's what is your timeline? Because once our doctors feel, yeah, you're suitable for treatment, we get the appointments in. But you got to remember, if you're going to have treatment such as using donor sperm or having to go through, insemination or IVF, there are certain processes that are required because you have to fill in questionnaires. We have to check them. You have to have some screening blood tests. We have to check they're all fine. And these are all requirements by HFEA, by the way. So we have to schedule those in. Now, if your timeline is really flexible, or you can slot in really easily, then of course this can happen in weeks, right? But if if we're saying, okay, busy woman, busy profession, then of course, then we will slot in as much as we can to fit your schedule, but then that could take a month or 2 months. And some patients actually come to me and say, actually, I think I might want to do treatment after Christmas. Was that fine? You know, have a glass of wine Christmas and then have treatment in the new year. I mean, you know, it all is very individual, but essentially the bottom line is it's as quick as you want it, or it's as slow as you want it. What I don't want patients to do is rush. If there was a scan I need you to do, all right, then we need to do that scan first. If there was a blood test or a test that I need you to do, you need to have those tests done first, right? Because those tests are done for a reason. And so, you know, so it varies depending on what you need, and then we plan. I think the best thing to do is to prepare, you know, yourself with all the things that's necessary first before you jump into the treatment, rather than going, have treatment and then, oh, by the way, oh yeah, we could have done that, we could have done that, right? I would say baseline test, make sure everything's complete, nice and confirmed, all fine, and then do that. But of course, for some patients, when they go through treatment, there may be things that they need to do as they go along when we discover them. Well, that's fine. Let's do that when it's required, right? But in essence, it's as quickly or as slowly that you wish us, and we are there to, you know, fit into your needs, basically, right? And I'm just looking at the question list to see other questions there, right? So some of the questions around sort of you know, how quickly can you see the donor sperm as a sperm donor list? Again, you know, once you're committed, you say you want treatment, yeah, of course, we'll plug you in the program and you can see the list, you know. What if there was not a donor we like? Well, if there wasn't anybody you feel that you like amongst all the donors that we have, I mean, there are some patients that go and purchase donors from donor sperm from outside us, well, in centers that we you know, where we have approved, right? So we have that list as well for you. But it's kind of like they feel, oh, you know, we want that set of quality, so they then import them. That's fine. You can do that. It's just liaise with our laboratory. As long as the screening procedures are in line with ours, it's absolutely fine, right? So you can do that as well. But as I say, you've got to be aware that at the end of the day, the characteristics is not definitive of what the child will look like. And you know, how many times you've been to parties where actually you know many kids around. Do you know which parent is which child's parents? Usually quite hard to tell if there's 60 children running around, right? So I think it's important. It's more important really to consider, okay, you know, your own personal preference is of course, but also of course, you know, the range of the choice that you would have if you broaden your choice. But it's very individual. Who you want to, you know, what characteristics you are interested in is very individual. At the end of the day, talk to our donor team and they'll give you really good guidance on this, right? Yeah. I'm just looking at other questions here. Are there any other questions anybody want to ask? Please type into the chat box, into the Q&A, whichever one you wish to type in. The other thing I get asked very frequently is, should I have acupuncture? You know, or traditional Chinese medicine or complementary medicine, and I'll say the evidence is equivocal. That means it's neither here nor there, but some of my patients find it really helpful. They do feel really relaxed. And so I said, carry on, right? But if you are really worried about needles, please don't, because that will stress you out even more. But the evidence at the moment, we've looked at this for many years, it flicks, to and fro. So I think it's probably, very individual, right, when it does this. So judge it for yourself would be what I say, right? Any other questions? Sorry, I'm just looking through there. Yeah, the other thing patients ask is how do I know when treatment starts? When does treatment start? And I would say normally, it starts at the time where you usually when you have a period. So when you have a period, we then do the scans and so on to start you off. And then of course the nurses will talk you through the fertility journey. So when do you come for scans and so on and so forth. So if you're based in different parts of the region, you can have your scans, Chichester, Portsmouth, Bournemouth, need not be always Southampton, depending on where you live, right? So it's quite flexible like that. Yeah. Just trying to see any other questions there. I don't see any more questions here. I mean, if you want to put in any further questions, please do that. If you missed it and you thought about questions, of course, send your email in. That's no problem. Or else, you can make an appointment to see a doctor privately, or if you wish, and a doctor can refer through the NHS. It's not a problem. We do both. But you can see the number here at the bottom of the screen, and the email info@completefertility.co.uk. And please do write into us and make an appointment. Don't forget there is an offer of donor sperm with webinar attendance. So please also remember that to refer to that when you come through. I see. There's no further questions. So if there are no further questions that people have not got, then I will close the webinar. And I thank you all for joining us and spending your evening listening to me. And I do wish that I would see some of you come through, and we'll do our best to get you to where you want to go. All right, so thank you very much once again, and I will now terminate the webinar. So thank you very much.